I think it's really important to talk about IWHI, so Integrated Women's Health Institute, in the women's health coaching certification. So that of course implies that it's a focus on women, looking at not just coaching, that functional nutrition, root cause, system approach, also supporting your business, whether it's building a business, incorporating it into your current clinical practice, finding a job, doing all the above, whatever that may look like. But this program is solely focused, which is not done anywhere else, on women.
Yeah.
As a whole.
Yeah. And, I did that deliberately on some level when I started this institute long ago, because clinically in my personal career had evolved from more general orthopedics to women's specialty orthopedics to women's and pelvic health in my physical therapy career. That was just simply the evolution of my career. And initially when I started this school, I was just interested. I was like knee deep. I was working in a hospital, the Women's Hospital of Texas, and it was just where my career interests lie. But over the years, that aspect of it has become even more important to me, that we focus on women's specific health. And that is because I think we've become more and more aware in the last few years in particular of how much of an uphill battle women actually do have to, how many more stressors we actually do carry. So even among married relationships, for example, women carry a significant heavier burden of household labor. Women carry a significantly heavier burden of kind of just that knowledge, like the work of knowing when your kids are need new socks because they've grown out of them. Is the permission slip due now, right? The emotional labor that women carry is dramatically higher than that of men. Women have to think about how they write an email. There's some cognitive labor around that to frame how someone who receives that email is not just going to gather the information about like what they're trying to say in the email, but then how the woman will be perceived. Mm-hmm. And the amount of excess emotional and true physical and cognitive labor that women have to carry is I think an represented or an valued amount of added stress, when we really understand that stress is at the root cause of many of these multi-system chronic illnesses. Having additional daily emotional, physical, and cognitive labor to do the exact same thing is really hard on a woman's health. And over the years, that is really wearing. And we also do see that women have particular illnesses at much higher rates: autoimmune disease, hormonal issues, chronic pain. And we layer on top of that women in the healthcare system are believed less about their chronic pain, even about, heart attack symptoms and things like that, even among female physicians. So if a female patient tells something to a female physician or a female clinician, doesn't necessarily mean that they're going to be better heard, because we have our own internalized patriarchal biases as well. And so that's all very problematic to health, and we have to stay focused on that. And when I say women, I actually do mean all women and people who are non-binary, people identify as women, because it gets exponentially worse let me put it this way. It gets even more challenging, and the data is very clear on this, if women are of lower socioeconomic status, if women are of color, if women are non-binary or LGBT or trans. Any layer of challenge on top of being a woman makes this a white, wealthy woman, makes this even harder. And so I think there needed to be a place where we can start to just recognize this. Some of this stuff, most of this stuff is so unconscious that, as I said, even women practicing clinicians are not even aware of their own biases. So we have to have a place where we can talk about this, where we can bring it into context so women are just have awareness of the extra stressors that they're carrying. Because if you don't know about it, then how are you going to negotiate a change in your own health behaviors, in your own relationships? And I think it's important to start having these conversations in a very respectful, mindful way, and be allowed to disagree about certain aspects of it. But this is just the facts. I mean, we have tons of science to show that, women are carrying these stressors at all levels that men don't carry. And it gets worse when women have more uphill battles to climb in their own distinct individual lives. And so we were the first women's health coaching certification to be approved by NBC-HWC very, very early on when any health coaching programs were approved at all. And we are still the only. And I think that speaks volumes to the fact that this is really needed, but very few people are willing to discuss how women do have a greater uphill battle when it comes to maintaining their own stress because of the layers or their own health because of the layers of stress that are distinct to women.
Yeah, absolutely. I 100% agree.